There is a machine standing between sick people and the help they need. It does not have a face. It does not have a heartbeat. It does not wake up in the middle of the night wondering if it made the wrong decision. It simply processes. It receives a claim. It measures the cost. It calculates the risk. It searches for a reason to say no. And if it cannot find one, it creates one. You do not understand this yet. You are 24 years old, wearing a shirt that still has the fold marks from the store. You are sitting in a training room on the 17th floor of Meridian Life Assurance, a health insurance company with marble floors, glass walls, and a mission statement printed in silver letters behind the reception desk. Protecting families. Restoring dignity. Putting people first. You believe it. That is the embarrassing part. You actually believe it. You are not rich, you are not powerful, you are not connected. You are just the first person in your family to get a corporate job with health benefits, paid vacation, and an ID badge that opens doors automatically when you walk toward them. Your mother cried when you told her you got hired. Your father shook your hand like you had just crossed into a better class of human being. And for the first few weeks, you feel proud. You sit in your cubicle with your new headset and your 2 monitors. You learn the language of the system. Prior authorization. Medical necessity. Network exception. Coverage limitation. Claim adjustment. Denial reason code. The words sound boring at first. Bureaucratic, harmless. Then you learn what they actually mean. A woman calls because her husband's cancer treatment has been delayed again. A father calls because his daughter's surgery has been marked non-essential. An old man calls because the medication keeping him alive has been moved to a higher price tier. You are told not to apologize too much. Apologies create liability. You are told not to say the word denied. Denied sounds cruel. You are told to say the claim did not meet coverage criteria. It is amazing how much violence can be hidden inside professional language. At the end of every call, you are supposed to ask if there is anything else you can help them with. Most people do not answer. Some cry. Some curse at you. Some simply hang up. And every night you go home to your small apartment, take off your badge, and tell yourself you are not the one making the decisions. You are just reading what the screen says. You are just following the policy. You are just doing your job. That is how every machine survives. One person at a time, convincing themselves they are only one small part of it. Her name is Elena Morales. You remember that because she is the first caller whose voice follows you home. She is 39 years old, a school librarian, 2 children, late-stage autoimmune disease. Her doctor has requested approval for a new biologic treatment that could stop the progression before her kidneys fail. The treatment costs $28,000 per month. Your screen tells you what to say. The request is still under clinical review. Elena is calm at first. She has probably learned that if she sounds too desperate, people stop listening. She explains everything carefully. She gives dates. She gives medical history. She gives the names of doctors and hospitals and prior medications that failed. You type notes into the system. Member expressed concern. Member requested escalation. Member advised of standard review window. Then she says something that makes you stop typing. She says, "I know you are just a person over there. I am not mad at you. I am just scared." You look around your cubicle. No one else has heard it. The room is full of people speaking in soft corporate voices while fluorescent lights hum above them. Everyone is processing someone else's crisis in 5-minute increments. You put Elena on hold. You message your supervisor. The supervisor is named Dana Cole. She is calm, polished, and impossible to surprise. She has the kind of face that looks sympathetic without ever becoming involved. You ask if the claim can be expedited. Dana walks to your cubicle, leans over your shoulder, and reads the file. Then she points to a line in the policy. Step therapy requirement incomplete. Elena has not failed every cheaper treatment yet. You explain that her doctor says waiting could cause permanent organ damage. Dana nods. Her eyes do not move. Then she says the policy does not account for fear. You wait for her to smile because part of you thinks it must be a joke. She does not smile. She tells you to close the call. So you return to Elena. You explain that before Meridian can approve the biologic treatment, she must attempt one additional lower-cost medication for 90 days. There is a silence on the other end of the line. Not anger, not confusion, just the sound of a person understanding that the door has been closed. Alina thanks you. That is what breaks you. She thanks you. 3 months later, her file is marked inactive. You ask Dana what that means. Dana looks at the screen for half a second and says, "Member deceased." Then she walks away to a budget meeting. That night, you sit in your car in the parking garage for 40 minutes before you can drive home. You stare at the concrete wall in front of you. And for the first time, the mission statement in the lobby feels less like a promise. It feels like a disguise. 2 years pass. You become good at the job. That is the second tragedy. At first, you thought becoming good would mean helping more people. You thought competence would give you leverage. You thought if you understood the system deeply enough, you could bend it toward mercy. Instead, the system teaches you that mercy is inefficient. You are promoted to claims adjuster. Your cubicle becomes an office. Your headset disappears. Now you do not take the calls, you review the claims behind them. There is a strange comfort in distance. Names become member IDs. Illnesses become cost categories. Surgeries become utilization events. Deaths become closed cases. Your salary increases. Your guilt becomes quieter. You learn which doctors write appeals that usually succeed. You learn which hospitals overcharge. You learn which families have the money and patience to fight and which ones will eventually give up because rent is due and grief is exhausting. You learn the invisible math of despair. Most people do not need to be beats. They only need to be delayed. Delay the approval by 10 days. Request additional documentation. Send the appeal to another review queue. Ask for a peer-to-peer consultation that no one schedules correctly. Wait. The sick are always fighting 2 wars. One against the disease. One against the paperwork. The second war is the one Meridian knows how to win. Dana becomes your mentor. She tells you that you have potential. She tells you that you see patterns other people miss. She invites you to meetings where no one says the word patient. They say exposure. They say leakage. They say loss ratio. They say medical spend. The first time you sit in a conference room with executives, you notice something strange. No one seems evil. That would have been easier. They are polite, educated, well-dressed. They ask about each other's children. They drink sparkling water. They use phrases like sustainable care model and long-term member value. Then they approve a policy change that will make insulin harder to access for 12,000 people. No one raises their voice. No one slams a fist on the table. A woman in pearls asks if the change can be presented as a modernization initiative. Everyone agrees. You sit there with a leather notebook in front of you, pretending to write things down. But all you can think about is Alina Morales. Her voice, "I know you are just a person over there." You want to believe that is still true. But you are no longer just a person over there. You are becoming part of the room. And rooms like this do not need monsters. They only need professionals. The algorithm is called CarePath. That is not its real purpose. Its real purpose is to predict which members are most likely to stop fighting. Officially, CarePath is an internal efficiency tool. It helps prioritize reviews, reduce administrative waste, and improve claim consistency across departments. Unofficially, it is a machine that measures human exhaustion. It studies income. It studies education. It studies location. It studies language preference. It studies previous appeal behavior. It studies how long a member usually waits before calling back. Then it assigns a score. Not a medical score. A resistance score. Low-resistance members are routed into delay-heavy workflows, more paperwork, longer review windows, less aggressive follow-up. Their claims are not always denied directly. They are simply buried under enough process that the person eventually disappears. You discover this by accident. You are now a senior review analyst, trusted with internal dashboards most employees never see. One evening, long after the office is emptied, you are cleaning old audit files when you find a variable buried in a CarePath report. Appeal fatigue probability. You stare at the words. At first, you think you are misunderstanding. So you dig deeper. You open archived model documentation. You read through internal memos with names like member journey optimization and adverse cost containment. And there it is. Plain, clinical, undeniable. Meridian has built a system that does not simply decide whether care is covered. It decides whether a person is likely to survive the process of asking. Your hands go cold. You copy nothing, you print nothing. You know enough now to understand that every action is logged, every file opened, every download tracked, every printer mapped to an employee badge. So you sit there in the dark office, reading as much as you can, forcing yourself to remember. Names, dates, models, committee members, approval chains, the signatures attached to every quiet cruelty. Dana finds you there. You do not hear her walk in. She stands in the doorway of your office and says your name. You look up too quickly. That is your mistake. Her eyes move from your face to the screen. She understands. For a moment, neither of you speaks. Then she walks over and gently closes your laptop. She tells you to go home. Her voice is kind. That makes it worse. The next morning, you are invited to the executive floor. The elevator ride takes 32 seconds. You count every one of them. The executive floor does not look like the rest of the building. There are no cubicles, no ringing phones, no angry callers, no fluorescent lights. Just warm wood, soft carpet, and a silence so expensive it feels designed to erase consequence. Dana is already in the conference room. So is the general counsel. So is Nathaniel Voss, the CEO of Meridian Life Assurance. You have seen his face on earnings calls and charity gala photos. He is always smiling beside hospital wings his company donated to, as if generosity is proof of innocence. In person, he is smaller than you expected. That surprises you. Power usually is. He asks you to sit. A folder is placed in front of you. Inside are screenshots of internal files you accessed, timestamps, system logs, policy documents. CarePath reports. For one stupid second, you think they are going to ask for your help fixing it. That is how much innocence you still have left. Nathaniel folds his hands on the table. He tells you that Meridian values ethical concern. He says every large organization has uncomfortable complexities. He says the public often misunderstands how hard it is to balance compassion with sustainability. Then the general counsel slides another document toward you. A separation agreement. 6 months of salary. Health coverage until the end of the year. A neutral employment reference. A lifetime confidentiality clause. You look at Dana. She looks back at you with something almost like regret. Almost. You ask if she knew what CarePath was doing. Dana inhales slowly. Then she says everyone knows what everything is doing. That is how companies work. The sentence lands harder than any threat. Because it is not said with cruelty. It is said with exhaustion. Nathaniel tells you that refusing the offer would be unfortunate. He explains that your recent access pattern could be interpreted as an attempt to steal proprietary company data. He says Meridian would have no choice but to protect itself. Protect itself. That is what the machine always says before it destroys someone. You do not sign. You stand up. Your chair scrapes against the polished floor. For the first time in your career, the room feels nervous. Nathaniel's smile disappears. He says your name again, softly this time. He tells you not to confuse emotion with leverage. You walk out. By lunch, your badge is disabled. By evening, your company laptop is wiped remotely. By midnight, every major employer in the industry has received a quiet warning about you. By the end of the week, Meridian has filed a complaint accusing you of unauthorized access, data theft, and attempted extortion. The story is simple. A disgruntled employee. A mental health spiral. A dangerous obsession. A company forced to defend itself. They do not need to prove it. They only need to make you radioactive. And they do. You lose almost everything. The apartment goes first. Then the savings. Then the friends who say they believe you, but stop answering after Meridian's lawyers send letters. Your parents do not understand the details. They only understand that the job they were proud of is gone, and your name appears in articles written by people who never called you. You move into a basement room beneath a laundromat owned by your uncle. At night, the pipes rattle above you, machines shake the ceiling. The whole room smells like detergent, mildew, and old coins. It is the lowest point of your life. It is also where you become dangerous. Because Meridian made one mistake. They believed evidence was something you had to download. They forgot that human memory was older than their security system. Every night after the laundromat closes, you sit at a folding table and reconstruct the archive from memory. You write down every name you remember, every meeting, every policy, every metric, every phrase they used to turn suffering into business intelligence. You map the company like a crime scene. Not emotionally, precisely. You learn public filings, court databases, state insurance complaints, hospital billing disputes, widow forums, patient advocacy groups, academic papers on claim denial patterns. You do not hack anything. You do not steal anything. You simply look where powerful people assume no one has the patience to look. And slowly a pattern forms. Elena Morales was not an anomaly. There are thousands of Elenas. Different states. Different diseases. Same delay language. Same escalation failures. Same care path routing signatures hidden beneath harmless administrative codes. You find former employees. Most refuse to talk. Some cry. A nurse reviewer in Ohio sends you a box of printed memos with no return address. A terminated compliance officer agrees to meet you in a diner at 2:00 a.m. and speaks for 11 minutes before fear takes over. A software engineer who helped build CarePath admits the resistance score existed, then spends the rest of the call begging you not to use his name. You become a collector of fragments. A sentence from one person. A memo from another. A lawsuit from a county court nobody read. An actuarial model referenced in a footnote. A mother's voicemail. A denied appeal. A death certificate. Piece by piece, the machine becomes visible. Not as a conspiracy. As a business model. That is the thing people misunderstand about corruption. They imagine smoke-filled rooms and secret handshakes. But real corruption has calendar invites. It has quarterly goals. It has compliance language. It has someone named Rebecca asking if the deck should use the word efficiency or optimization. And somewhere behind all of that, a human being is waiting for medicine that will never arrive. 3 years after Meridian destroys your life, you receive an email with no subject line. One sentence. I worked on CarePath after you left. Attached is a single spreadsheet. You know not to open it on your own computer. You take an old laptop to a public library, you disconnect every account, you open the file offline. There are 40,000 rows. Member IDs. Diagnoses. Claim outcomes. Appeal attempts. CarePath scores. Dates of death. For several minutes you cannot move. The spreadsheet is not just evidence. It is a cemetery. Every row is a person reduced to a data point. Every column is a quiet admission that Meridian knew exactly who would be harmed, exactly how, and exactly how profitable the harm would be. Then you see the author metadata. Dana Cole. You stare at her name. For years you have hated her. You imagined her as the villain who closed your laptop, sat in that conference room, and watched them erase you. But attached to the email is a second file. A letter. Not an apology. Something more useful. A confession. Dana explains that she stayed because she thought she could limit the damage, then because she was afraid, then because she had stock options, then because each year made the previous year harder to admit. She writes that Elena Morales was the case that made you suspicious. She writes that Elena was also the case that made her unable to sleep. She writes that she is dying now. Pancreatic cancer. Stage 4. Meridian denied one of her own treatments on the first pass because the policy she helped write required step therapy. That is the first time you laugh in years. Not because it is funny. Because the machine has finally eaten one of its engineers. Dana does not ask for forgiveness. She asks you to finish it. So you do. You assemble the archive into something no lawyer can dismiss as emotion. You build timelines. You cross-reference claim denials with internal model updates. You match public earnings calls to private policy changes. You connect executive bonuses to reductions in approved high-cost treatments. You prepare sworn statements. You find journalists who still understand patience. You find regulators who hate Meridian enough to listen. You find families who have nothing left to lose. And for the first time since the parking garage, you stop feeling like a ghost. You are not healed. That would be too simple. But you're no longer only a wound. You are a witness. The Senate hearing begins on a Thursday morning. Meridian's lawyers tried to prevent it. They failed. Nathaniel Voss enters the chamber in a navy suit and a red tie, surrounded by attorneys who look more expensive than most people's houses. He still has the same controlled smile, the same charitable face. The same careful posture of a man who has spent decades turning accountability into optics. You sit 3 rows behind him. He does not know you are there. Not yet. The first hour is theater. Senators give statements. Lawyers object politely. Nathaniel says Meridian is proud of its commitment to accessible care. He says claim review is medically rigorous. He says isolated errors are inevitable in any complex system. Then the committee chair asks about care path. For half a second, Nathaniel's face changes. Only half a second. But you see it. He says care path was an administrative prioritization tool. He says it was never used to deny medically necessary treatment. He says any suggestion otherwise is a dangerous mischaracterization spread by activists who do not understand healthcare economics. Then the first spreadsheet appears on the screen behind him. 40,000 rows. His name in the approval chain. Dana's confession entered into the record. Internal emails. Bonus structures. Appeal fatigue probability. The chamber goes silent. It is not the silence of confusion. It is the silence of a room realizing that the polite language has failed. A senator asks Nathaniel to read one sentence from an internal memo. He refuses. The senator reads it for him. Members with low persistence profiles represent significant avoidable exposure. Avoidable exposure. That is what they called people. You watch Nathaniel's hands. They are steady at first. Then they are not. The cameras catch everything. By noon, the footage is everywhere. By closing bell, Meridian's stock is down 32%. By evening, state attorneys general announce coordinated investigations. By midnight, hospitals suspend contract negotiations. By the next morning, Nathaniel Voss resigns to spend more time with his family. They always find their families when the subpoenas arrive. But you are not finished. Public shame is temporary. Systems survive shame. You want structural damage. So your legal team files a civil action on behalf of thousands of families. Not for pain. Not for apology. For records. Discovery is the only word in law that still sounds like justice. And once the doors open, Meridian cannot close them again. 5 years after your badge flashes red for the last time, you walk back into Meridian Life Assurance. The lobby is different now. The silver mission statement has been removed. There are protest scratches on the marble floor where security barriers used to stand. Half the building is leased to another company. The stock never recovered. The brand still exists, but only as a smaller, frightened version of itself. Nathaniel is awaiting trial. Dana is dead. Elena Morales has a foundation named after her. And you are older than you should be. That is what revenge never tells you. Even when you win, you do not get the years back. You do not become the person you were before the betrayal. That person is gone. He died slowly in conference rooms, parking garages, court filings, and the basement beneath a laundromat. You take the elevator to the 17th floor. Your old department is empty. Rows of abandoned cubicles sit beneath dead fluorescent lights. A few monitors remain on desks, unplugged and dusty. Someone left a coffee mug behind with a faded slogan on it. We care differently. You stand where your first cubicle used to be. For a moment you hear the old sounds. Phones ringing. Keyboards tapping. Dana's heels in the aisle. Elena's voice on the line. I know you are just a person over there. You close your eyes. You used to think the machine was built by monsters. Now you know the truth is worse. It was built by ordinary people who wanted salaries, promotions, stability, and permission not to think too deeply about the consequences of their work. People like Dana. People like Nathaniel. People like you. That is the final cruelty of every system. It does not begin by asking you to be evil. It begins by asking you to be practical. You leave the office without taking anything. Outside, the city is moving like it always does. Ambulances in traffic, office workers with coffee, a mother holding a child's hand at a crosswalk. Somewhere, someone is on hold with another company, listening to soft music while their life is being reviewed by a stranger. Across town, a young woman steps into a different glass building for her first day at a different insurance company. She is 24 years old. Her shirt still has the fold marks from the store. Her mother cried when she got hired. Her father told her he was proud. She sits in a training room beneath a mission statement printed in silver letters. The instructor smiles. The slides begin. She opens her notebook, ready to learn the language of the system. She has no idea what the words will cost her. She has no idea whose voice will follow her home. She has no idea that one day she will be asked to choose between her life and her conscience. The machine is wounded, but it is not dead. Machines like this rarely die. They change names. They change logos. They change the words on the wall. And somewhere in a room with no windows, someone is already building the next version. The cycle continues.